And one of the commonest sources of higher inflammation is food. So food is the major area. So once you've taken care of your food, then you need to look at other sources of where the inflammation could be coming from. Number 4 is again something that I actually test for. I check for your sitting disease risk, and there are some online calculators you can Google for them. Ideally, your daily sitting, continuous sitting. So continuous sitting is supposed to be as bad as or even worse than smoking. And continuous sitting impairs your brain activity, raises your blood glucose levels, impairs your muscles. And your muscles are an extremely important organ when it comes to your blood glucose levels. So obviously, remember the 3 fundamentals. So blood glucose, blood pressure, and inflammation, all those are impacted by muscle function. And sitting continuously impairs your muscle function quite a lot. So there was a paper a few years ago, type 2 diabetes sits on a chair. So how long are you spending sitting continuously, and what can you do to stop that or reduce that? Next comes sleep, 7 to 9 hours of restful sleep. Do you feel rested when you wake up in the morning? That is the most important question to ask yourself. Or if you're using a wearable device, you will also know that you can check your sleep data on that. And if you're not sleeping not getting restful sleep, there are ways to manage that as well. Another important factor I wanted to mention is if you are sleeping longer than 9 hours, that could be a red flag for mood disorders or cognition as well. So that is something you need to also be aware of. Number 6 is exercise or movement. So 150 to 300 minutes of moderate intensity activity per week. What do I mean by moderate intensity activity? So moderate intensity activity is anything that you do which makes you, you can speak, but you can't sing. So you can have a conversation when you're doing moderate intensity activity, but you cannot sing. And higher intensity activity is when you can't even talk. So things like, shoveling, gardening, these are also moderate intensity activity. And in 2020, actually, Canada came up with a very nice guideline. This is called the 24-hour movement guidelines. And I absolutely love it because, what you do throughout the 24 hours actually makes all the difference. Even if you have done high intensity exercise in the morning for half an hour, 1 hour, whatever it is, and then you spend the rest of your day sitting at your job or you're watching a lot of television, that completely takes away all the benefits from that exercise in the morning. And when it comes to your brain fitness, particularly, moderate and higher intensity activity actually is extremely important because there is something called BDNF, brain-derived neurotrophic factor. So higher BDNF levels help in keeping your brain sharp and preventing dementia. And moderate intensity exercise raises your BDNF levels even more. Now, interestingly, this 24-hour movement guidelines, the Canadian 24-hour movement guidelines also has added, standing time. So are you spending a lot of time standing? That can be included in your movement time as well. And a few years ago, I made a decision that every Zoom call or webinar or, any of this, I'm going to do in standing up. So I've moved the chair away from my workplace, workroom. So I work mostly from home. And so now if I have to sit, I actually have to go and find the chair and bring it along to the table. So that's just basically how I decided to design my environment. So what are the things you can do? Number 1 is figure out what it is for you. Are you spending a lot of time sitting? If you are, what are some of the strategies you can implement? Maybe if you are someone who has a lot of phone calls at work, can you walk when you are, walk at home when you are on your phone calls? That is one of the strategies that my patients and a lot of other people find very beneficial. And at the end of today's session, I'm going to talk about an upcoming course that I'm very excited about. This is a brain health course. So going back to the 24-hour movement guidelines, so reduce sedentary time, again, extremely important.